Stop cutting dairy out of your diet because you think it's the reason for all that mucus in your throat. If a friend, a pharmacist, or even your own doctor ever told you to quit milk and cheese to dry up your throat, I need you to hear this. That advice has been tested, retested, and debunked for over 30 years, and it is quietly costing you the calcium your bones need most right now. So, if dairy isn't the villain, what actually is? The answer is going to surprise you because it isn't in your nose at all, it's in your stomach. Here's the research that should have ended the milk myth decades ago. In a landmark study, 60 adult volunteers were deliberately infected with a cold virus and tracked for 10 days, with researchers physically weighing every tissue used to measure actual mucus output against how much milk each person drank. Milk and dairy intake was not associated with any increase in nasal secretion rate or respiratory symptoms, even in people drinking up to 11 glasses of milk a day. A follow up, double blind trial gave people either real milk or a soy drink disguised to taste and feel identical, and the people who believed in the milk mucus connection reported the exact same coating and thickness sensations from both drinks, meaning what they were feeling was texture, not mucus production. If you've spent years avoiding dairy for nothing, that's not your fault. That's decades of kitchen table folklore outrunning the science. So let's talk about what the actual research says is driving that throat mucus. Because there are five real, measurable causes. And the one sitting at the very top of this list is something almost nobody over 60 gets checked for, even though studies suggest it may be behind more than half of all chronic throat clearing cases. We'll get there. But first, four causes you can start correcting today. Before we go further, I want to know who's in this conversation with me. Drop your age in the comments below. I read every single one, I promise you that. And tell me this, is your mucus worse the moment you wake up, or does it build steadily through the day? Hold that answer in your mind, because by the end of this video, you'll know exactly why the timing matters. Let's count it down. 5 causes of chronic throat mucus, ranked from least powerful to the one that changes everything once you fix it. 5 to 1. Number 5 is dehydration, and specifically what it does to a process called mucociliary clearance. Picture the lining of your nose, sinuses, and airway covered in millions of microscopic hairs called cilia, working like a synchronized rowing crew, sweeping mucus backward toward your throat, where you swallow it dozens of times a day without ever noticing. When you're hydrated, that mucus is thin and glides easily, the oars pulling through open water. When you're dehydrated, that same mucus thickens into something closer to wet cement, and the cilia beat just as hard but can't move it, so it pools, and you're stuck clearing your throat to shift it manually. A study of 888 older adults in Taiwan found that low water intake was significantly associated with both obstructive and restrictive lung impairment, particularly among elderly participants, and linked this directly to reduced mucociliary clearance and thicker mucus from impaired secretion dynamics. Encouragingly, the same body of research found that these declines in lung function measurements were rapidly reversed through simple water supplementation, which tells us this one is genuinely fixable, fast. Why does this hit older bodies harder than younger ones? After 60, your thirst reflex quiets. You can be meaningfully dehydrated without ever feeling thirsty, which is why so many people assume they're drinking enough simply because they don't crave water. I think of a man I'll call Frank, 68, from a small town outside Amarillo, who'd been clearing his throat every morning for 3 years and blamed it on Texas dust. It turned out he was drinking 1 cup of coffee and almost nothing else until dinner. Within 2 weeks of spreading 64 ounces of water evenly across his day, his wife told him he'd stopped doing that throat thing during their morning crossword. The practical version of this is simple. Don't chug one large glass and call it done. Sip steadily from the moment you wake. Favor room temperature water since it's absorbed faster than ice cold water. And if you're on a diuretic, pair your water with an electrolyte source. Because plain water alone can pass through you without properly rehydrating your tissue. Number 4 is medication. And this is the cause almost nobody connects to their throat because the side effect shows up nowhere on the pharmacy label warning you'd actually notice. Several classes of blood pressure medication, along with certain diuretics, are documented to increase or thicken mucus secretions as a side effect. On top of that, diuretics themselves, commonly prescribed for blood pressure and heart conditions in older adults, deplete the body's fluid reserves, compounding the dehydration problem we just covered. A study looking specifically at drug consumption and hydration status in elderly patients found that cardiovascular drug use was significantly associated with lower water intake, creating a kind of double hit. The medication reduces your drive to drink while simultaneously altering your secretions. The reason this hits harder after 70 is that most people this age aren't on one medication. They're on 4, 5, sometimes 7, and side effects don't add up one at a time, they compound. Margaret, 79, from a suburb outside Columbus, had been on the same blood pressure medication for 11 years and never once mentioned her throat clearing to her cardiologist because she assumed it was unrelated. When we reviewed her full medication list together, we found two separate drugs on her regimen, with documented mucus and dry mouth side effects working against each other. We didn't take her off anything reflexively. That's not something to do on your own. But her physician adjusted timing and dosage, and within a month her throat clearing dropped by more than half. My advice here isn't to stop any medication on your own, ever. It's to bring a written list of every prescription, including over the counter ones, to your next appointment, and specifically ask whether any of them are known to affect mucus or secretions. Pair that conversation with tracking your symptoms for 2 weeks beforehand, noting time of day and severity, because that log gives your doctor something concrete to work with instead of a vague complaint. Before we go to number 3, if this video is giving you information your own doctor never sat down and explained, hit subscribe because we cover one of these overlooked senior health topics every single week. And hit like so more people your age find this before they waste years on the wrong fix. Alright, let's keep going. Number 3 is the structural aging of your nose and throat lining itself. And this is where the science gets genuinely fascinating. As you age, the glands lining your nasal passages undergo what researchers call atrophy, meaning they shrink and produce less fluid overall, while the surrounding cartilage weakens and the tissue thins. You'd think less fluid would mean less mucus, but it's the opposite. This atrophy widens the nasal cavity and speeds up evaporation of the thin protective mucus layer, leaving what remains thicker, stickier, and far more prone to crusting and dripping down into the throat instead of clearing forward. Research on rhinitis in older adults found these nasal symptoms, including postnasal drainage, affect up to 32% of older adults, significantly impacting quality of life. Compounding this, the viscoelastic properties of nasal mucus itself change with age, becoming excessively thick, and there's a documented increase in cholinergic nerve activity in the aging nose, which independently drives up postnasal drainage. This is where the aging process gets specific in a way that matters for you. Think of your nasal lining at 30 like a well maintained garden hose, flexible, evenly coated, water flowing exactly where it should. By 75, that same hose has thinned walls and cracks in the lining. So instead of a smooth flow, you get pooling, drips, and residue building up in places it shouldn't. This isn't a disease, it's a structural change, which means it responds well to structural solutions. A cool mist humidifier running in your bedroom overnight, kept at 40 to 50% humidity, directly counters the evaporation problem. Saline nasal irrigation using a neti pot or squeeze bottle with sterile or distilled water, once in the morning and once in the evening, physically thins and clears the crusted mucus. Your weakened cilia can no longer move on their own. The synergy tip here matters. Irrigate first, then humidify, because clearing the thick residue before adding moisture back lets the humidified air actually penetrate the tissue instead of sitting on top of dried mucus that's already there. Robert, 65, from a coastal town in North Carolina, told me he'd resigned himself to just being a mucus guy for a decade. He started twice daily saline rinses and a bedroom humidifier. Nothing else changed in his routine, and within 3 weeks he described his throat as feeling, in his words, like it belonged to someone 20 years younger. That's not an exaggeration I hear often, and it's why this one sits at number 3 rather than lower. Number 2, and we're getting close now, is swallowing dysfunction, something almost nobody over 60 has ever had formally evaluated. Swallowing feels automatic, but it's actually a highly coordinated sequence of nerve and muscle activity connecting your mouth, throat, and esophagus. With age, those swallowing muscles lose strength and coordination, just like muscles anywhere else in the body, a process related to what researchers call sarcopenia, the age related loss of muscle mass and function that affects roughly every muscle group in the body after 60, including the ones you never think about using. Clinical sources on this describe how, during sleep specifically, swallowing frequency drops sharply. So, secretions that would normally be cleared throughout the day accumulate overnight, which is exactly why so many of you told me in the comments on past videos that your worst mucus hits the moment you wake up. Here's the analogy that makes this click for patients. Imagine a delivery truck route that runs smoothly every 20 minutes all day, keeping the warehouse clear. At night, that truck only runs once every few hours. The warehouse, your throat, still receives the same deliveries of saliva and mucus, but there's nobody there often enough to move it out. So by morning, everything that built up overnight is sitting right at the loading dock, and the first thing you do is cough and hawk to clear a backlog 8 hours in the making. This is precisely why morning mucus and daytime mucus often have completely different root causes, even though it feels like the same problem. The practical fix starts with sleep position, elevating the head of your bed by 6 to 8 inches, using a wedge pillow rather than just stacking regular pillows. Uses gravity to assist the swallow reflex and reduce overnight pooling. Beyond that, simple swallowing exercises, sometimes called the effortful swallow, where you consciously swallow hard and hold for a second before releasing, done 10 times, twice daily, can measurably strengthen the same muscle groups clinicians train in patients recovering from stroke related swallowing difficulty. Pair this with the hydration habit from earlier in this list, because a well hydrated throat lining makes every swallow more efficient, and a stronger swallow clears mucus. Your weakened cilia are struggling to move on their own. Which brings us to number 1, the most powerful, most overlooked cause of chronic throat mucus in people over 60. Laryngopharyngeal reflux, often called silent reflux, because unlike classic heartburn, it produces almost none of the burning sensation you'd expect from stomach acid. Instead, it shows up exactly where you'd never think to look for it: your throat. Here's what's happening physiologically: the valve at the top of your stomach, called the lower esophageal sphincter, is meant to keep stomach contents where they belong. With age, that valve can weaken, and unlike typical reflux, which happens lying down at night, silent reflux frequently strikes during the day, while you're upright, cooking, walking, sitting in a chair reading. Tiny droplets of acid and enzymes travel all the way up the esophagus into the throat and even the back of the nose. And because the throat lining has none of the acid resistant protection your stomach lining has, it reacts by producing thick, defensive mucus to coat and protect itself. That thick mucus is exactly what you're feeling and clearing all day long. The numbers here are what convinced me this deserved the top spot. A study screening over 2,300 adults using a validated reflux questionnaire found the prevalence in the general population was 11%, with no significant difference between men and women. In clinical populations specifically presenting with throat complaints, the numbers climbed dramatically. One study found over 57% had visibly thick mucus on direct laryngeal examination, and a separate hospital based study in Tanzania found that among patients diagnosed with the condition, over 90% showed thick endolaryngeal mucus on scope examination, making it the single most common physical finding. Broader estimates suggest that up to 60% of patients presenting with chronic throat symptoms may have underlying silent reflux without ever reporting classic heartburn. Why does this become so much more common as we age specifically? Beyond the natural weakening of that esophageal valve, older adults are more likely to be on medications that relax smooth muscle tissue, more likely to eat larger meals earlier and then lie down within a couple of hours, and more likely to carry excess weight around the abdomen, all of which increase pressure that pushes stomach contents upward. One study looking specifically at this condition found lying down less than 2 hours after a meal, along with spicy or fatty food consumption, were the leading risk factors identified. Dorothy, 72, from a small town in Ohio, had been diagnosed with chronic postnasal drip by three different providers over 6 years, tried every allergy medication and nasal spray available, and nothing worked. When we finally screened her using a reflux symptom questionnaire, her score came back well above the diagnostic threshold, despite the fact that she told me flatly, I've never had heartburn a day in my life. Within 6 weeks of simple changes, not eating within 3 hours of bedtime, elevating the head of her bed, cutting back on the acidic coffee she drank all morning, her throat clearing had dropped so dramatically her husband asked if she'd had surgery. The practical steps here matter more than any of the other four items on this list. Stop eating at least 3 hours before lying down. Not one, not two, three, because it takes that long for your stomach to substantially empty. Elevate the head of your bed, not just your pillow, since gravity needs to work on the entire upper body to keep stomach contents down. Reduce your intake of the classic triggers: caffeine, alcohol, chocolate, mint, and fried or fatty foods, all of which relax that esophageal valve further. And here's the synergy tip that ties this entire list together. Pair these reflux changes with the hydration habits from number 5, because adequate water intake helps dilute stomach acid and supports healthy digestion timing, meaning the top and bottom of this list actually reinforce each other. If you only fix one thing after watching this video, screen for this one. Ask your doctor directly about laryngopharyngeal reflux. Use those exact words, because if you simply describe mucus in my throat, you may get sent right back down the sinus and allergy path that never worked in the first place. I want to leave you with something before you go. Every single cause on this list: dehydration, medication side effects, structural aging changes, swallowing weakness, and silent reflux has one thing in common. None of them are permanent sentences. None of them mean you simply have to live out your years constantly clearing your throat, embarrassed in restaurants, exhausted from broken sleep, avoiding conversations because you're afraid of what your own voice sounds like right now. I have watched patients in their 70s and 80s reclaim something as simple and as profound as being able to sit through a 2 hour church service, a grandchild's recital, or a long phone call with an old friend without interruption, without apology, without that constant nagging need to excuse themselves. That is not a small thing. That is independence. That is quality of life. And it is never ever too late to go after it, whether you're 62 or 92. If this video gave you even one thing to bring up at your next doctor's appointment, subscribe, because we tackle exactly this kind of overlooked senior health topic every week and share it with someone you know who's been quietly dealing with this for years. Tell me in the comments, which of these five causes do you think is behind your throat mucus, and are you finally going to bring it up with your doctor? I'll be reading every answer.